Our dietary recommendations, which have been an enormous bust, look around you, have been based entirely on this fear of cholesterol and this belief that cholesterol causes heart disease. If that's not so, and it's not, then the entire dietary recommendations of the last 30 years collapses like a house of cards. The last two major studies that looked at saturated fat and heart disease, not at saturated fat and cholesterol, which is just a marker, a surrogate, and a bad one at that, but looked at saturated fat and heart disease, found zero relationship, zero. And those are two major studies, one of which was done at Children's Hospital in Oakland. So this whole concept that fat is what's causing the damage to our arteries and to our health in general and making us fat, sick, tired, and depressed is wrong. It's just wrong. That's not the problem in the diet.
But aren't there good fats and bad fats?
There are good fats and bad fats, and they do not divide according to unsaturated and saturated. They divide according to damaged and non-damaged. Undamaged fats, natural fats that occur naturally, like in coconut, in grass-fed beef, in any form, are not bad fats. Bad fats are fats that have been overheated, that have been reused, that have trans fats in them, that have carcinogens, that have heterocyclic amines, that have been heated, reheated, the kinds that are used in fast food. When we made the swap out from lard, which actually is not a bad fat, real lard, not Crisco, not vegetable shortening, but actual animal lard. When we made the switch to high omega-6 vegetable oils, canola oil, we actually made a terrible swap out because those fats get damaged when they're heated, and they get even more damaged when they're reheated the way they are in restaurants for 7 days in a row before they throw the oil out and change it. That was a horrible swap out. So, you know, the sense that there are bad fats and good fats is completely true, but it's not true that the bad fats are the saturated ones and the good fats are everything else. There's more and more accumulating evidence that some of these vegetable fats, which are hugely high in omega-6s, are actually very pro-inflammatory. They upset the balance between omega-6s and omega-3s, which are one of the biggest predictors of health, of human health, and they're probably not all that great for us. And I have a feeling that one of the reasons that low-fat diets work, and they really don't, but to the extent that they get benefits, is not because they're cutting out saturated fat, it's because they're lowering the contribution of omega-6s to the diet, which is way too high to begin with. The advice to replace saturated fats with polyunsaturated fats is simplistic and incomplete. Polyunsaturated fats come in two flavors, omega-3s and omega-6s. They're both important for health. They're both vital for health. They're both essential for health. But the balance between the two is equally important. It's like sodium and potassium. They have this symbiotic relationship. It's not that one's bad and one's good. They need to be in balance. And so the same thing is true with the omega-6s and the omega-3s. Here's how it works. Omega-6s are the precursors to inflammatory compounds in the body. We need those inflammatory compounds because they're part of the healing process. You have an injury, there's a lot of fluid that goes to the area, there's a little inflammation. It helps protect from an infection to the rest of the system. So you get a lot of white blood cells in the area and you get this inflammation. That's important for healing. We need inflammatory compounds. We need them to be in balance with anti-inflammatory compounds. So your anti-inflammatory compounds that your body produces come from omega-3s. You need about a 1-to-1 relationship. All the studies of Paleolithic men show about 1-to-1, can be healthy up to 4-to-1 in favor of omega-6s. That's a good, healthy balance between inflammatory and anti-inflammatory. The current American diet produces 16-to-1 ratio in favor of omega-6s. Some studies show up to 25-to-1 in favor of omega-6s. That means we're funding our inflammatory army to the tune of about 16,000 times more dollars than we are giving our anti-inflammatory army. That's the bigger problem. So replacing saturated fat with the general term polyunsaturated fat, which usually means vegetable oil, is a big mistake. Is it the agricultural revolution that perpetuates? Look, here's the wrap on that. The human genus, or our predecessors, have been on this planet for 2.4 million years. Agriculture was invented 10,000 years ago, so it's like a second in the 24-hour time clock. It definitely made civilization possible, so we want there to be agriculture. We wouldn't have cities without agriculture. We couldn't feed 7 billion people without agriculture. But it has a downside. It introduced foods that are new in the human experience, like grains, which can be very inflammatory for people, which can cause all kinds of different problems, from neurological to gastrointestinal to, the entire spectrum of human problems. They're not for everybody. And a grain-based diet that is so high in grains and so high in foods that convert to sugar so quickly have produced a lot of problems. So I wouldn't put it all at the foot of the agricultural revolution, but I would certainly question the notion that all products that come from grains are wonderful and healthy and should be consumed in large amounts, while we put saturated fat and the other foods that occur naturally in the human diet, to the side. Well, the foods that have been demonized in the process of demonizing saturated fat include, let's just take coconut as an example. Coconut's a superfood, and it's very high in saturated fat. It's a particular kind of saturated fat called medium-chain triglycerides, which the body uses a little bit differently. But the studies, going back to the 70s, of the Trobriand Islanders, who get about 80% of their calories from coconut, show they couldn't measure heart disease. And yet we have, up until very recently, avoided coconut and coconut oil because it's high in saturated fat. It's one of the healthiest fats you could possibly consume. Butter, which is, by the way, mostly monounsaturated fat. Beef. Now, here's a double-edged sword on meat. I can never recommend meat as we consume it in the United States. Factory farmed meat is poison. It's just horrible, horrible food. It's loaded with antibiotics and steroids and human growth and bovine growth hormone and antibiotics and just a whole host of things you don't want in your body. It's very high in inflammatory omega-6s. It has no omega-3s. So meat as we eat it here, generally speaking, is a horrible food. Grass-fed meat, which somehow got condemned also because it's meat, is a health food. Grass-fed beef, cows that are raised on their normal diet of pasture, have high omega-3s. They have high cancer-fighting CLA, is conjugated linoleic acid. They're low in inflammatory omega-6s, and they don't have any antibiotics or steroids. It's a great source of protein, and people won't eat it because it's got saturated fat, which is idiotic.
What about eggs?
Eggs are a perfect example of one of nature's most perfect foods that's been demonized because it's got cholesterol. Do you know why eggs have so much cholesterol? Did you ever think why reptile eggs and bird eggs are loaded with cholesterol? Because there is no umbilical cord to the fetus. That cholesterol is that necessary for life. That's why the egg is loaded with cholesterol. You need that. And the cholesterol in eggs, first of all, the cholesterol in the diet has no bearing whatsoever, except for like 1% of the population, has no bearing on cholesterol in the blood. And we've known that. Even the inventors of this theory knew that all along. So cholesterol in the eggs is a non-issue. The saturated fat in the eggs is a small amount of it, but when you get the whole egg, you have all these nutrients that are found in the yolk, like lutein and zeaxanthin and choline for the brain. I mean, this is a perfect, absolutely perfect food, and people throw the yolks away because of this idiotic fear of saturated fat and cholesterol, which is just completely, I don't want to call it moronic. I understand why they were taught this, and they think that this is sensible, but it's not. It's just completely wrong. Ansel Keys' theory that saturated fat and cholesterol were at the heart of heart disease was not the only theory in town. I don't know what you did in Australia and England, but here in America in the 80s, we had a big war over the formats for home recording. We had VHS and we had Betamax. And these two companies, these two, Sony and Philips, they competed like crazy which one was going to be the one that wound up in everybody's living room. And if you ask any recording engineer in America, Betamax was the better product. They still use it to this day. It was a superb product, but it lost the war. And it lost the war because the VHS people had a better ground game. They signed up more movie producers to put their movies on VHS. They signed up more manufacturers to make VHS for home recording, and they won the format war. The wrong technology won. The same thing happened with the dietary wars in terms of heart disease. You had Ansel Keys on the one hand saying it's fat and cholesterol, but you had a competing theory. And probably the main proponent of this theory was a fantastic physician in England named John Yudkin. And his theory was, he said, Ansel, It ain't fat and cholesterol. Sugar tracks with heart disease 100 times better. And he had graphs and data to show it. He showed that, if you're just doing correlation studies, television set ownership tracks with heart disease better because these things can be surrogate markets for other things. When you have more television set ownership, you have a more sedentary society, you have a more industrial society, you have more processed food, you have more smokers, you have more a million things. So it's not the television sets causing it, but it correlates better. Sugar had means, motive, and opportunity. It tracked better. So you had these two theories, these two competing theories, with all the academic jealousies and all the infighting that occurs anytime these things take place. And much like with VHS and Betamax, the wrong theory won. Ansel Keys won the argument, but it was the wrong argument that won. He won the public perception and the acceptance of the medical and health establishment about his theory. But John Yudkin was right all along. And we're finding that out now. We're going back and looking, dude, it's not fat, it's sugar. Sugar is inflammatory. Sugar is without, in my mind, there's very little question that it's sugar, which raises insulin, raises blood pressure, causes inflammation, is directly related to diabetes. I call it diabetes because diabetes and obesity are so blended at this point that they're almost like one syndrome. Sugar is at the scene of the crime for all of those. Sugar is far more damaging to the heart than fat ever was. And we're beginning to see this now. So yes, there were these two theories, and the intervention studies that were designed to support Key's theory, lower fat in the diet. Everybody's going to get better. Women's Health Initiative. It doesn't work. Mr. Fit study doesn't work.
Okay, so let's get into that detail, because after Key's hypothesis, there were large, expensive trials that were undertaken, like the Mr. Fit study and the heart protection study. What did the Mr. Fit study tell us in a nutshell?
That it's a good idea to stop smoking. The Mr. Fit study, you can sum up in one sentence. It's a good idea to stop smoking. The Mr. Fit study, which has been clocked in at between $100 and $180 million of taxpayer dollars, depending on who you read, but at least $100 million, was a colossal failure. They took these men at high risk. They were smokers, they had high blood pressure, they ate a lot of fat, all the things that people thought led to, and they divided them into two groups. And one group, they told all of them about their risks, and they sent one group, the control group, home to their doctors, and the other group, they did the intervention on. And they showed them how to control their blood sugar and how to eat less fat and how to stop smoking, and why these things were important. And at the end, there was zero difference between the two groups. Now, there have been many hypotheses about why Mr. Fit was such a dismal failure. One is nobody followed the instructions. At the end of the study, 65% of them still smoked, and half of them didn't have their blood pressure under control. The other hypothesis is the control group didn't just sit there. They got warned about all these risk factors. They went home and they said, I better make some changes. So maybe they did some more and the other group didn't do much, but there was absolutely no difference between the two groups. Not one life was saved. $100 million was spent. So that was a dismal failure of dietary intervention. The Women's Health Initiative, the other big low-fat study, I don't think this is controversial anymore. It was a complete failure. The low-fat diet did nothing. In fact, I can't think of a single study, a good study, on low-fat diets that has shown any improvement on anything. Yet we all continue to believe that that is the holy grail of healthy eating, and it's not. When you believe something, you ain't letting go of it no matter what the evidence is. So these people do these low-fat studies, and they come out dismal, and nothing works, and they go, yeah, but the low-fat diet is still the right way to go. It's a psychological kind of thing that people do. It's called confirmation bias. People see the evidence that confirms what they already believe, and the same thing is true here. We believe in that low-fat diet, and we're going to stick to that story and damn the evidence to the contrary, because it's got to be wrong. It's got to be something wrong with the study. Cholesterol, not only has it been demonized unfairly, but we have forgotten that this is one of the most essential molecules for life that we can think of. Without cholesterol, you die. It's like those old ads about this is your brain on drugs. And I used to do lectures and workshops. I show a balloon, and this is your body, this is your cell. Without cholesterol, You pop a balloon. It's needed for thinking. It's needed for memory. It's needed for the brain. It's needed for the immune system. Your sex hormones come from cholesterol. Vitamin D comes from cholesterol. So when you look at the side effects of lowering cholesterol aggressively, what are they? Lack of libido and sex drive. What a surprise. Loss of memory and thinking. What a surprise. Muscle pain. Well, there's no coenzyme Q10. Of course there's muscle pain. So it's one of the most valuable and essential molecules that we have that supports life. To me, one of the travesties of this cholesterol demonization is that you now have the pharmaceutical companies mounting a multi-million-dollar campaign to get children on cholesterol-lowering medications because we want to catch heart disease early. Okay, cholesterol is needed for the brain. Let's look at an ABC equation. The child's brain is not fully formed. The prefrontal cortex doesn't finish growing. This is not controversial till age 25. So you're going to put a child whose brain isn't finished growing yet on a medication that's going to rob him of one of the most essential nutrients for that brain. And you're going to put him on this in an attempt to reduce a disease that isn't related to the cholesterol in the first place. That is the next thalidomide waiting to happen. And if anyone's listening to this who's a parent who's got a kid whose doctors told him to go on a statin drug, I beg you, change doctors. In America, we have an epidemic of what we call ED, erectile dysfunction. I can't prove this. This is not a scientific theory. It's my gut feeling. I don't think it's a coincidence that we've tried to put every middle-aged man in America on statin drugs. If, in fact, cholesterol is the precursor for sex hormones, which it is, if you make your testosterone, your estrogen, all of the sex hormones from cholesterol, and we are aggressively lowering this important molecule in all middle-aged men, it doesn't surprise me that we have a libido problem in America. 80% of the cholesterol in your body is made by your body. If you eat less cholesterol, you're going to make more cholesterol to make it up. Your body needs a certain amount of it. So the fact that you eat less and you do all these things are not necessarily going to mean that the cholesterol isn't going to arrive in the plaque when it's formed. You have to ask what causes the plaque to be formed in the first place. Look, we have forest flowers out here in California where we are right now. They're a very big problem. Now, you could eliminate forest flowers by cutting down every tree that exists. You wouldn't have any, because there'd be nothing to burn. There'd be a few ecological side effects to that, a few aesthetic side effects to that, a little bit of collateral damage to wiping out the forest and the ecosystem, but you would get rid of the forest fires. It's kind of the same thing. Cholesterol winds up in this plaque, but you've got to ask what happens to the cholesterol to damage it? What happens to create the plaque? What's the injury that it's trying to repair? What's the injury that causes that festering of inflammation and oxidation that causes that to be a substance that becomes plaque? You have to ask those questions like you would ask, well, what causes these trees to go on? Maybe it's that they don't have enough water. Maybe that they're too crowded. Maybe there's some other conditions of dryness that take place there. So before you go with a wholesale, let's wipe out the forest, let's wipe out the cholesterol, let's look at what happens in the body to cause this little injury to accumulate these different things that don't necessarily belong there and to cause the plaque to, number one, form, and number two, become unstable.
So you think cholesterol is an innocent bystander?
I think cholesterol is pretty much an innocent bystander in this process, yes. I don't think cholesterol has no role in heart disease. Clearly, the small oxidized particles are in there. They're causing some inflammation, some oxidation, some damage. It's not that they have no role, whatever, but they have a minor role compared to the real promoters of heart disease. And the fact that we've been obsessively concentrating on lowering this very innocuous and incredibly important molecule means that we've taken our eye off the ball of the real promoters of heart disease, and we're not paying any attention to those. And those are things we can actually do something about. This notion that the cholesterol that we eat matters and that we should limit cholesterol in the diet has been around. It is mind-boggling and baffling to me why that still exists. The guy who is most responsible for the cholesterol hypothesis taking hold, the guy who put this on the map in the first place, Ansel Keys, he didn't even believe that cholesterol in the diet mattered. And his quote, and I quote him exactly, is, cholesterol in the diet doesn't matter a whit unless you are a rabbit or a chicken, and we've known that all along. Nonetheless, doctors still tell you don't eat more than 300 milligrams of cholesterol a day. It's nonsense advice, except for the 1% of the population who has a genetic condition called familial hypercholesterolemia. It runs in families. 1 in 500 people have it. With the exception of that group, let's take them out of the mix for the moment. For 99% of the people, the cholesterol you eat makes not a whit of difference on any level whatsoever. The Lean Diet Heart Study took 605 people who were walking dead. These guys were insurance underwriters' nightmares. They had every risk factor you can imagine. They smoked, they had high blood pressure, they ate a high-fat diet, they had high cholesterol. It was just a mess. And they randomized them to 2 groups. One group, they said, go to your American doctors and do what they tell you and do your, and lower your saturated fat and eat a prudent diet and don't eat any eggs and all that stuff. And the other group they put on a Mediterranean diet, which we'll talk about in just a minute. They stopped the study midstream because they had a double-digit reduction in heart disease and cardiac-related events in the Mediterranean diet group. And that's the part that you just brought to my attention. Here's the part that nobody talks about. So you'd think that in the group that had the double-digit reduction in heart disease, their cholesterol levels must have plummeted, right? The cholesterol levels didn't budge. Both groups had the same cholesterol levels, except one group just stopped dying. So much for the relationship between cholesterol and the risk for heart disease. That's one thing the Lean Diet study showed, and probably the reason that the lead researcher, the famous French cardiologist who's so respected, says cholesterol is harmless. But here's the other thing. We talk about the Mediterranean diet like we all know what that is. There's 20 different Mediterranean diets. They're all up and down the Mediterranean. Some of them eat lots of meat, some of them don't. There is saturated fat in the Mediterranean diet. Some eat grains, some eat less grains. The Mediterranean diet has a much higher amount of fat. It has a lot of olive oil. Those are some staples that we associate with it. They probably eat a little bit less red meat. But more importantly, most of the red meat that they eat is like lamb and things that are grass-fed and not factory farmed. They do eat a lot of nuts, a lot of vegetables. There's a lot of things in the Mediterranean pattern of eating, but there's no one Mediterranean diet. You can eat an Atkins diet and be on the Mediterranean diet. You can eat a vegan diet and be on the Mediterranean diet. It encompasses, it's all things to all people. So it's a good, safe recommendation to make, but nobody really knows what it is, and you can't get a good definition of it anywhere. The Mediterranean people eat their big meal at lunch. They don't talk about that part of it a lot. They laugh a lot. They spend a lot of time out in the sun. The Greek men sit together and talk about their feelings. There's lots of non-dietary things in the Mediterranean region that we could probably learn from that have a profound effect on endpoints like heart disease and are not because they're eating olive oil. Sure, the olive oil is great, but they're not getting all those results because they don't eat saturated fat. We've got to look at the pattern of life there. And all the other things, and the effect that has on stress, and things we haven't even thought about yet.
So do you think we should go back to eating eggs and cheese and animal fat?
I have this theory about what we should be eating. First of all, I don't think there's any one diet that's right for everybody. I think that there's a huge amount of biochemical individuality, different metabolisms, hormones, ethnicities. I mean, just the microbiome, which is a huge area of research right now on gut bacteria. All of these things play enormous factors. You go to Greenland, they don't have vegetables, don't grow there. You go to the Bantu of South Africa, they eat 80% carbohydrate diets. What all these diets have in common is that they eat from what I used to call the Jonny Bowden 4 food groups, foods you could hunt, gather, fish, or pluck. So the question is, if you were naked on the plain in the African savannah with a stick, what could you eat? And that, I think, is the best model for the human diet. It's going to be different in Greenland than it's going to be in South Africa. It's going to be different in the coast of Ireland than it's going to be, in the Midwest of America. But to the extent that we can mimic, and we can't do it perfectly, we're not going to go out and catch our dinner and gather our acorns, but to the extent that we can kind of mimic what our Paleolithic ancestors ate, food you could hunt, fish, gather, or pluck, food without a barcode. To the extent that we can do that, I think our health is going to have exponential growth. So does that mean more saturated fat? It means natural foods that come with it. If there's, our Paleolithic ancestors didn't eat low-fat caribou. They didn't go after low-fat wildebeests. They ate what they could catch and hunt. If there was fat with that, so be it. You know, there were no low-fat diets in the hunter-gatherer societies.